What is diabetes?
Diabetes is the term physicians use to describe a range of disorders, all of which result in increased blood glucose levels. So high blood sugar above a certain degree would qualify for the diagnosis of diabetes. The actual technical term is diabetes mellitus.
What are the types of diabetes?
There are two broad types of diabetes. The type 1 diabetes is typically the result of the body running out completely of insulin. It used to be called juvenile onset or childhood onset, but really that's not strictly accurate because even older people can develop type 1 diabetes, in fact, practically at any age, although generally it tends to be commoner in young persons. Type 2 diabetes, on the other hand, is not the result of the body running out of insulin, but it's the result of a more complex reorganization of the way the body handles energy and the body metabolizes glucose. The amount and pattern of secretion has gone abnormal, such that for the degree of demand on insulin that the body imposes, the supply is not matching the degree of demand. Broadly speaking, 90 to 95% of all cases of diabetes we see throughout the world is type 2. And type 1 diabetes contributes about 5 to 10% to the burden of disease.
What are the symptoms?
Drinking excessively and urinating excessively are classic symptoms of diabetes. But if you ask me, does everybody living today with diabetes show those symptoms? The answer is a resounding no. In fact, until recently, 50% of people with diabetes were undiagnosed because they had no symptoms and they had no need to go to a doctor and say, check me for something.
What are the risk factors?
Risk factors, the first requirement is that it does run in families. So there is a genetic risk factor, which we believe to be a very important prerequisite. Certain environmental factors, such as gaining weight or being physically inactive or eating certain kinds of foods on a habitual basis or being exposed to other comorbid factors like having hypertension increases your risk for having diabetes. Having high cholesterol increases the risk for having diabetes.
Can diabetes be prevented?
So people often ask when they hear about this prevention, they say, what's the name of the drug? Well, there is no drug. Most of us do not believe it is really a compelling strategy to use chemicals to prevent diabetes when we have the abundant evidence that non-pharmacological lifestyle adjustments, modest changes to the way we eat, the way we live, return a powerful investment gain in terms of preventing diabetes.
How can diabetes be managed?
We manage diabetes generically using 5 pillars of intervention, 5 pillars. We monitor, because what you do not count, you cannot possibly hope to control what you cannot count. The second pillar of management of diabetes is education. We educate our participants and our patients and their loved ones to understand the major knowledge areas of diabetes. Dietary modification is the third pillar. It's not easy to change the way you've eaten all through your life. Then you develop diabetes and you have to change it. So it's a gradual peeling away of the old habits. So then the next is exercise. Physical activity is as important in the diabetes management as is any drug that you can conceive of, including the shots. Then finally, of course, you need medications. So we need a comprehensive care plan that is based on the MEDM principle, 5 pillars of care.
What is the diabetes belt?
A series of contiguous states and counties, mostly strewn across the southern and southeastern states of the Union, consistently showed higher rates of diabetes than the national average. At the time the term was introduced, the numbers were national average was about 8.5%, and counties within the diabetes belt were having 11.5 or higher, and Shelby County at that time was 11.7, significantly higher than 8.5.
For more information about diabetes, go to the website of the American Diabetes Association.